Good afternoon and welcome to all the Radio Zindagi listeners, and thank you for tuning in. We are now bringing a special broadcast today called Voices, the COVID Pandemic and the New Norms. For those who don't know me, I'm Renu Dillon, the founder of Genius Kids, an educational learning center with centers all over the Bay Area. I'm also a regular host on Radio Zindagi with my own show, Candid Conversations, which is, of course, on a COVID-19 sabbatical at this time. But before we begin the show and meet our panelists, a special shout out to Saba Shah, Neeraj Dar, and Radio Zindagi team for always being so innovative in addressing critical topics that affect the community at large. So what will life be after COVID-19 crisis ends? Or is this ever going to end? Everyone is talking about a new norm. What the heck is a new norm? And if you're seriously asking me at the age of 60 to start learning to live a new life, I'm not sure I want to do that. There's so many possible scenarios as our world begins to tumble through this pandemic. Are we all seriously going to have to learn to reinvent ourselves as human beings? Are we heading towards a world of one-way sidewalks, medical grade shields at the theater, cashless societies, no swabs and temperature readings at every travel gate, virus-proof bodysuits? I mean, the list is endless. Should we be optimistic or pessimistic? There's a spectrum of possible post-coronavirus futures, and there's no straight line from here to there. This is exactly why we are all bringing this broadcast to you today, and hopefully many more, because there are so many unknowns. This show is for the community and by the community, so we want you to participate by sending your questions on Facebook or Messenger, and we will definitely try and answer them. And on that note, I'm honored to introduce my co-host, who actually needs no introduction, and so many other panelists, amazing members. Most of them are so much younger than me, so we won't even address that. Whenever there is a community concern, wherever it may be, Arun Goel is a face and name you will always see. Arun was elected to office in 2016, served on the Planning Commission for 4 years. He's a civil engineer with experience in highway, airport, and intelligent transportation systems. With expertise in project delivery, Arun uses his professional experience as a leader for the city of Dublin. And he's also currently, I believe, the acting vice mayor. He's an active entrepreneur with business in real estate and travel. And for those who don't know, Arun was actually my teacher when he was a teenager. Before I came on air for my radio show, he was actually my DJ and taught me how to run a radio show. So thank you, Arun, and welcome. And over to you, Arun.
Thank you, Ms. Renu. It's great to be back helping out the community and making sure we share the most up-to-date information that we have. And as we introduce the panel, one thing that we do want to say is this pandemic is real, it's live, and it's continuously changing the way we are going to be interpreting our time. So with that, I would like to introduce Trustee Kuo from the City of Dublin, Dublin Unified School District. She was recently elected in November of 2019. She's a dedicated Dublin parent, a local activist, born in Redwood City to a Korean immigrant parents, and grew up in Saratoga, California. She went to UCLA, where she received a BA in psychology with business emphasis. Catherine's professional experience is in HR and recruiting, a business analyst, and planning management.
Our next guest, well, welcome, Catherine. Our next guest is someone I go back many years as well with, Narinder Taneja. He's one of the highly regarded consultants in business and commercial real estate, mergers and acquisitions, business valuation, and real estate financing. As a trailblazer in the real estate industry, Narinder has had a vast amount of experience and offers services such as mergers and acquisitions, commercial real estate investment, development and consultant, commercial real estate loans. The list is endless. Welcome, Narinder.
Thank you.
Welcome, Narinder. And our next panelist is Dr. Preeti Parekh, an MD in internal medicine and obesity medicine. She's American board certified in internal medicine and obesity. She practices her primary care at One Medical in Dublin. She has developed her own health model called 4 Wheels of Health. Dr. Parekh is a writer, speaker, and regularly posts health videos on her YouTube channel. Her latest episode included Cancer and COVID-19 with Sonali Bendre.
Welcome, Dr. Parekh.
Thank you.
Our next guest is Rishi Bakshi, building and growing Entero's footprint. Who doesn't know who Entero is, right? In the Bay Area, into the entire East Bay of Northern California. Rishi started his real estate career at the age of 21 You still look 21, Rishi. Right out of Cal Poly University. After just 3 successful years in the business, he opened his first real estate office in Fremont under the Intera brand. He's now partner and managing broker for the Intera real estate offices in Fremont, Union City, Pleasanton, Livermore, Milpitas, and Pleasant Hill. Welcome to the show.
Thank you so much.
Thank you for joining us, Rishi. And our next panelist is Ritu Panesar, a CEO of TravelPod, a travel professional with over 15 years of experience, focused on providing her customers a hassle-free travel booking experience. Ritu aims to provide friendly and expert advice with competitive fares on international air tickets and customized travel planning.
Welcome, Ritu.
Thank you very much.
Our next panelist is Vikram Bambari. He comes from a technology background, having worked in senior leadership roles at Microsoft, Dell, and IBM, where he currently runs product management for cloud. Vikram and his wife Anu started Roo about 4 years ago, expanding now to 6 locations across US and India. Roo was driven out of passion for food, I like that, and bringing Indian cuisine to the forefront of American dining scene. Welcome, Vikram.
Thank you so much.
Getting hungry. Welcome, Vikram. Our next panelist is Yogi Chuk, a community leader and political activist. Yogi is an executive managing director at S5 Advisory, a corporate real estate advisory firm. Yogi has lived in Fremont for over 37 years and has been deeply involved in the community, where he currently serves as an economic development commissioner for the city of Fremont and serves in a leadership role on various nonprofits. He is passionate about communities coming together and how public service and political engagement can positively create impact in our local communities.
Welcome, Yogi.
All right.
Okay, on that note, we're ready to start our show. Thank you to all the guests that have come this afternoon and giving up your time. And again, thank you, Arun, and thank you, Radio Zindagi. Over to you, Arun, to begin the show.
Excellent. Thank you, Renu. As many people have on their mind, education, our school system. We're fortunate to have Trustee Kuo with us. Trustee Kuo, today, the California State Department of Education had a discussion on the safe reopening of California schools. Can you share any details that may impact our listeners as we return to the new norm? Maybe about how our school districts preparing and what should parents expect this coming fall, especially related to confidence of their child's health?
Thank you so much, Vice Mayor Arun, Renu, as well as Radio Zindagi. I wanted to say that the conversation this morning with Tony Thurman and our California Department of Education was actually more of a confirmation of what has been released so far. So unfortunately, they did not release any new guidelines today. I think what we can go by right now is the CDC guidelines that were released 2 days ago on May 19th. And I wanted to put in a special note for that because I think they were sort of widely panned as sort of impossible to be able to implement on a wide basis. And if you kind of read through some of these items that they put forth, it does seem like that. But I wanted to have everybody step back and realize that they put these things forward as considerations. So I think the 3 most important things they asked pretty much all of our local school districts to consider is, first of all, are we consistent with all of our local, county, and state orders? I think, you know, our counties are aware of best what is going on in our communities. So we want to make sure we are in keeping with our state and local orders. Also, are our schools ready to protect our children and teachers that are at a higher risk for severe illness? And the third thing is, are we able to put into some practice or screening students and employees as they arrive for certain symptoms such as a fever? So those things are sort of the top things they've asked local schools to start considering. Once they get past those items, they've got a list of things, and I think you have heard of many of them on the news in the last week, things like encouraging staff and students to stay home if they're sick. I thought one of their best recommendations that all of us can do is temporarily get rid of those attendance awards, because if kids are focused on making sure they go to school every day, they don't want to miss it if they're a little bit sick. So I felt that was the most practical. Also other things just like enforcing good hygiene, mask wearing among older kids, and really frequent cleaning and sanitizing of high-touch surfaces. And again, the CDC really let us know that these things really have to be implemented where it's practical and acceptable to our communities. So they've really left it up to our local schools to determine what that means to us. Really, I think like in Dublin, they just released an email actually yesterday to our communities that let them know that they are prepared for 3 different scenarios, and they're really trying to make sure that they have those 3 bases covered for this coming fall. It's really truly a developing situation.
Thank you so much. You know, I have a lot of things to say, Catherine, about what the CDC guidelines are, considering I run a daycare, and some of the ideas are just not even practical for anyone to even operate a business, but we'll get there later. I guess I should pose my next question to Narinder, right, Arun?
Absolutely.
We're going to make sure that all the panelists get a chance to give their thoughts and views on the subject, and then we're going to engage in the ones where we want to really get into them. So, Narinder, how do you see commercial space changing post-COVID-19, and what are the impacts on landlords that are being realized? And on that note, do you know of any nice landlords we can talk to?
Yeah, basically the landlords are already affected. According to my numbers, April, they didn't get at least 56% of the rents. They could not collect it. And now it depends on the length of this COVID and the location of the COVID, how things will move. Certain areas are good, certain not good. So, and depend on the rates. Different shopping centers are very high rate where people cannot afford to pay the rent. So this will be kind of a tuck and war and go a little long way. And
but Narendra, do you think any of the landlords are willing to even talk to tenants about the fact that, you know, they've got all this fine print in their leases that you can't get out of a lease when you have nothing to operate?
I think most of them are in a mode of negotiation, renegotiation, or giving, offering some different deferment of rent or renegotiation or kind of things to reduce the rent. And they can't afford to lose the tenants too. And this time, any tenant walk away from the building, it will be very hard to reoccupy.
I think those are all great points. And, you know, as an elected official looking at the city economics and its tax base, that is something that we have on our forefront to make sure our occupancy ratings can be maintained. That way, when we return back open, our tax and our revenue that takes to operate cities come forward. So I think it's going to end up becoming a joint partnership at some level with landlords, the tenants, and with the different jurisdictions as far as who can help what to what extent.
And I believe there will be down the road on coming time and months, a lot of properties will be available for rent. A lot of occupancy is going to be increased. A lot of people may go out of business. And of course, the rent rates are going to be reduced and as well as the property value is also going to be affected now because the cap rates are changing. And similarly with the business, since I'm in a mergers acquisition, because a lot of business are shut down, it affects the cash flow, and cash flow affects the value of the business.
Very good points. Let's move on to our next panel member, Dr. Parikh. Doctor, how are clinical and medical offices serving their clients via telemedicine? You know, we're hearing in the news that a lot of patients are postponing or deferring getting medical attention for maybe non-emergency items. They're delaying getting vaccines or getting the necessary injections. Can you share a little bit about how the hospitals and medical offices are trying to serve their patients?
Hello everyone, and thank you Radio Zindagi for inviting me today. Arun, you're right. The way we practice medicine has somewhat is an understatement. It's changed a lot in the last few weeks. Most of us have moved from virtual platforms like emails, phone calls, and video visits. And it's the best way to connect with patients to take care of their needs, and also best way to support our community ER so that they can focus on critically ill patients and not be overwhelmed. Now, you raised a very good point, Arun, that patients are hesitant to come in. They're hesitant for maybe a couple of reasons. First, they're worried about being exposed to the virus. And secondly, Anything that's non-COVID related, they think it should wait. And yeah, that's my message to everybody, that don't ignore your symptoms. Talk to your provider to see if your health concern can be handled virtually, or if you need to come in. And for those with chronic issues, again, don't put these issues on the back burner. And in terms of safety, clinics, a lot of clinics are making changes to decrease the risk of exposure. For example, One Medical, where I work, respiratory clinics have been separated from regular clinics. Lobbies and workstations have been rearranged to make sure that everyone can stay 6 feet apart. Exam rooms are cleaned and sanitized with disinfectants that are EPA approved for coronavirus after each patient with potential COVID-19 symptoms. Patients are asked to come on the right at their appointment time so that they don't have to wait in the lobby. They're asked to come by themselves if possible, so that they don't risk the additional guests. The guests they bring, they're not risk. They don't risk exposure. They're given mask if they don't have one already. HEPA filters have been installed to purify air in all the lobbies and exam rooms. So you can see a lot of precautions are being made, and so there's no reason to worry as such. Call your provider, see if your issue can be handled virtually or if you need to come in. But please call us, let us know if you have a concern or an issue.
One quick follow-up. You mentioned the 6-foot social distancing. In your opinion, how are you seeing that work out? And is it really making a difference from what you're seeing?
Absolutely, Arun, you raised a very good point. It's crucial to slow down the spread of the virus. And most of us, I think we're doing our part, but we can do better. It's very tempting to take a walk with your friend, or have a chai with your neighbor. But please remember, people can spread virus before they know they are sick. So it's important to practice social distancing when possible, even if you or the other person does not have symptoms. And quite honestly, I like to use the word physical distancing than social distancing, because now more than ever is the time to connect with your loved ones, and loved ones virtually. The mere sound of your loved one can help calm the stress response in your body. And to answer your question, Arun, it's very important. Physical distancing is very important. The other day, somebody mentioned that I'm taking this way too seriously, but my message is we all need to. I urge you to take this seriously, because at this point, this is the only defense we have.
Thank you.
Thank you. Thank you for that. So thank you a lot. It keeps your mind reeling when you're listening to all this stuff, and every day you put on the TV and there's always so much new information. So Rishi, over to you. What are the impacts being realized in real estate? The market was booming not such a long time ago, and now with the COVID, have you been as impacted as small businesses? I'm curious to know that.
Very good question. And first of all, I want to thank Vice Mayor Arun and our business Renu for having me on. First of all, before I go over my what I think that really happened with our real estate industry, and a lot of positive came out of it too. I would encourage everybody, just like we tell everybody at Intero, is turn off the news, right? You're only going to get inundated with negative information. Get your highlights, go to CNBC. It's good to be informed, but don't get caught up in the commentary, because you're going to be paralyzed and fear will take over. And our job is definitely not to be, in fear mode. So what happened, 2 months ago, which has gone by pretty quickly. Let's go back to early March. We were actually presented with 4 to 5 shocks in our real estate industry. And the first one, of course, was a stock market plunge that happened immediately after shelter in place was announced, which was, expected, which obviously impacted our market. Number 2, there was obviously the shelter in place orders and restrictions, which limited our real estate salespeople and also our home buyers and sellers to fully be able to do their job of, presenting and selling properties. So that was a big, obstacle that we dealt with from March 17th until May 4th. May 4th, we were actually able to finally show owner-occupied properties, and some restrictions were loosened. Number 3, what happened out of the 4 or 5 shocks that we faced right away was that there was a lot of mortgage rate volatility. And people didn't know, whether to apply for a loan, do a refinance. There was a lot of things going on with the banks, with all their PPPs and all the other things that they were trying to manage at the same time. Number 4, which actually is probably the biggest factor right now that we're facing, is not a lack of demand, it's a lack of housing supply. And we'll talk about all the plus points. You know, in fact, there's some positive signs, like the amount of demand that has come out of this for buyers, but we had a huge amount of supply that went down, and a lot of that was because owner-occupied properties could not be shown. So the only properties that realtors in our offices could show, or any realtor would be vacant properties, which limited ourselves to show the actual inventory on the market. And then 5th, of course, there was a lot of job uncertainty across the country, and even in our robust local economy. So we felt, we dealt with 4 or 5 critical shocks to the system right away. But over the time, just like we've all had to do in business, and I think in real estate, we're fortunate that we were able to, adapt with the times. And the 2 biggest words we use a lot in our business right now is pivot and adapt. So we've been able to do that. And then there's a lot of good things which we can cover. I want to keep that within a minute, but good things that have come out of the last 8 weeks or so.
Well, those are all great points. And, we're seeing that at the city level, what's going online relative to sales, how people are reacting relative to staying safe. Not many people wanting to go visit the open houses. So thank you for sharing that. Next, I'm going to pick over to Ritu. Ritu, travel. It's on everybody's mind. A lot of people are getting ready to ramp up for summer vacation. And midst of it, we're starting to see that, the airports are at an all-time low. Airports like San Francisco are operating at less than 5% of its capacity 12 months prior. And so what do you think are necessary components to bring the confidence back to your traveler when they board a plane, when they get to a destination? What do you
Yeah, thanks, Arun, and thanks, Renu and Radio Zindagi for having me. A great question, Arun. I think the foremost important thing right now for any traveler is to have the confidence that it is safe to travel. Not only for the traveler itself, but for the entire travel ecosystem. It's so important that they talk about it, they address this issue, and then they bring the confidence back. And to be very honest, they're all working towards it, because the safety, security, and health is the foremost for anybody right now. May it be the airport authority, the airlines, the baggage claim area, the cabs, the hotels, the entire ecosystem. And there is a lot of change that needs to happen. Everybody needs to adapt to the new norm, from the ecosystem to the travelers themselves as well. Travel was the most impacted industry, I would say, right now, and we were in the travel industry, we could see we were the first one to get impacted. And unfortunately, the impact going to last the longest for the travel industry, because people will only travel if they really need to travel, at least for next 12 months or so that we see. The domestic travel in the US has started picking up. We can see the TSA numbers going up little by little, down below up to almost 90,000. All across America, we are reaching 300,000 now. So, which means there's an upward trend to it slowly. The precautions I think that they all need to take, and the trust that they all need to have, is that airlines are doing their best that they can do in these times. Some of them are claiming to be even cleaner than hospitals, and they're going all out to make sure that their staff is taking care of everything. Their planes are clean, and from the airport authorities are doing everything, starting from the baggage disinfection. So we have to think about that also, not only just disinfecting ourselves, but baggage needs to be taken care of as well. So I think slowly, I think it won't come immediately, but we can see the confidence coming back in American travelers, at least for the domestic travel. And they are making sure that the flights are clean, that they are picking up. United, Delta, American, Southwest, all are doing their extremely best possible way to make sure that the flights are clean, that they are on time, they are not calling off the flights at the last minute to cause even more anxiety in passengers. So I think, yeah, all in all, the entire travel ecosystem is working hands in hands to make sure there is a confidence in people to travel back.
Yeah,
Thank
great
you for your
points. You know,
insight. Thank you so much.
one of the things that we're seeing happen in the travel industry is at San Francisco Airport, we're going to be experiencing the European flights starting to come in June.
In June, right. That's what they're getting ready for.
And then the IATA, which is the conglomerate of all of the travel agents, are actually trying to unify to make sure that they have standards that they can relay onwards. So thank you
That
very
is true.
much for sharing that.
So quick reminder to all those tuned in, you're listening to Radio Zindagi, a special broadcast for the COVID pandemic and the new norms. And we have a whole panel today of people from different fields, from real estate, medical, commercial real estate. We have city officials, and of course we have Genius Kids. But anyway, so thought I'd add a little bit of humor to the whole show. I was getting all stressed out listening to this, but I'm glad to hear that things are getting a little better. I'd like to see the daycare industry get a little better. The kind of guidelines we've been given to operate, we might as well just run a school for one child. But on that point, let's move on to Vikram. Let's talk about the food industry, Vikram. How are restaurants coping with the current situation of curbside pickup? Because I'm one of these people that wants to go in and look at my food.
So first of all, thank you so much for having me on the show. Before I answer the specific question, let me give you a couple of points, right? Food or restaurants outside of breathing and one more copious activity is considered to be the only activity that gives you this feeling of escapism, right? Where you can escape even for 40 minutes, 50 minutes or an hour out of your busy day jobs of doing everything else, right? And now in this environment, when you can't go into the restaurant, can't go to your favorite bar, can't, some of the restaurants are not even open, it becomes very important to make sure, the restaurants are doing, of course, their part, but as customers, people are doing their part to support them in their, time of need. So some stats, there are pretty decent number of restaurants that are actually open for curbside delivery. Out of the restaurants that are open, 60% are actually operating at loss when they are actually delivering food. But it's important for us to keep the ecosystem going because people need escape. And that's essentially what across the industry I've talked to high-end restaurants, low-end restaurants, takeaway places, and everybody's just doing enough to make sure people's needs are taken care of. And even besides that, there's a pretty good program that's been run, whether it's frontline workers or World Kitchen or even local organizations where restaurants are being engaged to actually have food delivered to healthcare workers, right? We are doing our part. We're delivering to UCFS hospitals, Stanford, bunch of other hospitals, police, hospitals, or even fire department, just the other day. So I think it's a way for us to continue to, besides supporting the community, also making sure that we are keeping the people employed. The restaurant industry in general employs about 11 to 12% of the US working population. So that means about 50 million people that are employed through this industry. And today, as of now, I would say not even 20% are employed. But even to keep those 20% employed, you have to do a lot of hard work to get keep the restaurants going.
So Vikram, I'm curious to know, just like we have guidelines at schools to maintain social distancing between the children, I'm sure you have the same for any sit-down restaurants. So do you see that the probably fast food is going to be a better option for people versus any sit-down restaurants? I mean, don't you think the sit-down restaurants have been really impacted?
Absolutely, they have been impacted, and they've been impacted in more than one way because we actually just received, State of California issued a 12-page guideline, which talks about the specific measures that the restaurants need to take. And some of those guidelines are so stringent that one might not even open the restaurant in the first place.
Right.
But I think there are good conversations happening at the county level where they're talking about how can we increase the overall capacity of the restaurant beyond what's inside the restaurant. So there's conversations in city of Palo Alto or San Francisco to open up curbside, open up sidewalks, parking garages, where you can actually start to put sit down customers.
Mm-hmm.
So I think it's going to be important for a vibrant culture of the city to have both sit down restaurants as well as fast food or delivery as options available, right? The delivery industry right now in 2019 was about $30 billion. And by 2030, it's going to grow to about $300 billion. So that means there's going to be a lot of emphasis on people picking up food, but I don't think it sort of take the emphasis away from that personal connection that you establish when you go to the restaurant. So It's going to be a struggle. It's going to be a while before things really get back to the new normal. But I'm hoping, and I'm always an optimist that we'll adapt to the new normal.
Yeah,
absolutely. Yeah,
really good points. And at the City of Dublin, what we are doing is we're evaluating opportunities of making Main Street type locations, providing temporary barricades to block off areas and extend seating accommodations into the open air. Because one of the considerations in the restaurant industry really is how are they going to be able to keep that kind of space? What do they do with fixed seatings? And does open air actually provide an additional benefit? And we're hearing a lot of that from the restaurants. All great points. Yogi, I want to pivot over to you for a second there, buddy. How are you seeing the community reacting and starting to feel safe? What are some confidence builders that you think consumers need to do to support these businesses? Because, as Narendra mentions, as Vikram mentions, as Preeti mentions, everybody is needing to have some sort of confidence. What's it going to take, in your opinion?
I think just listening to everybody else, obviously it's been evidently clear that this pandemic, COVID-19, has impacted every walk of life. To the point that Rishi made, everything creates an opportunity, right? There's a recovery, there's a tunnel, there's light at the end of the tunnel. We're in the tunnel right now. So if you had to ask me how are consumers feeling right now, I think they are vulnerable. We've gone through a very rigorous shelter in place where I think at least in Alameda County, Santa Clara County, people have been very good about this. But I think the biggest question that most municipalities are now dealing with is ensuring that the recovery doesn't become worse than the disease. That's a question. I think this is the delicate conversations that people are having. In order to come back and give confidence, I think people are looking for leadership. I think they're looking for a way to recovery. As a part of that, let's just give the example of small businesses, right? People will come as long as they know that it's safe. How do we become safe? Contact tracing and testing is vital. The federal government has pivoted to the state has pivoted to the counties, and the counties are now pivoting this to the municipalities. I think the leadership, all we have to do is to come back and emphasize to people that the road behind us has been a difficult one, but the road ahead will be good. And if we work together, we'll actually come out of this stronger. For small businesses, I think the grants, providing the incentives to allow them to come back, giving the renters the relief that they need, and protecting the landlords. I think it's a trifecta of circumstances, which is what we got to focus on.
I think you bring up great points, Yogi. At the city, what we've done is we created opportunities, although it may be small, we created a micro loan package for our business to try to survive a little bit. I think right now, every little bit counts. There's people in the market share talking about the Paycheck Protection Program and how successful they were or were not to get the money. And then it shows up, but then it came down with a whole lot of new conditions that many didn't experience. Renu, I know you could most probably talk a little bit about that.
Absolutely.
So straight over to you, Renu.
Yeah, well, I know we have a lot of questions we want to answer, but I can talk a lot about it because I think, it's especially for those, I consider myself a small to medium-sized business, and I can definitely speak on behalf of franchisees and so many of my other friends or business owners that unfortunately, even though you get the PPP, the restrictions are it doesn't make any sense. Employees do not want to come to work. Let's face it. they're making more money. Some of them make more money on unemployment, okay? They do not want to come back to work. Now what happens is the PPP is telling you to use your funds within 8 weeks. You have to start using them immediately. And I have no idea how they allocated 75% towards payroll, because no business runs at 75% payroll and 25% to utilities and rent. It just doesn't make sense. And for someone like myself, I look at this and I'm like, why even bother? So that's a whole other show in itself. And I know Rishi also has some comments about some of these issues, but we have a lot of questions we'd like to get to before we move on. And I just mentioned to Seb, I know this show is going to need a follow-up. 1 hour is definitely not enough to talk about the new norms for sure. So one of our first questions, do you want me to go with the first question, Arun?
Yes, go for it.
Okay, one of the first questions was, was a PPP. We're not even going to go there. Bunty from New York asked, when are schools going to open and what will be the norms? Well, Bunty, I wish I could answer that question. I think with the guidelines that we have, with having only 10 children in a classroom, social distancing, and so many other requirements of having teachers cannot change in the room, even centers, schools, daycare centers really need to figure out ways. I mean, as daycares, we're monitoring everything from temperatures at the door, staff temperatures, I mean, the whole works. But it's not easy to run your business with just 10 kids in a room when your capacity was 80 and now you're down to 30. So I think play schools will start opening only when shelter in place is lifted and when parents get a little bit more confidence that it's going to be safe to send their children back. So that's the answer, my answer to that question.
You know, I think Trustee Kuhl, I'm not sure if you have any insight to share regarding after school programs like that the schools are offering. They may have some of these additional types of activities. Is there any indication on how they're anticipating that this?
Yes, actually, I participated in a conference call with quite a few other local trustees, and most of them, by all indications, have agreed that after-school activities such as sports, any sort of arts, are not looking good right now, just because it's very difficult to maintain distance as well as to ensure that people don't spread germs through whatever activity it is, so or the virus through whatever activity. So just definitely don't count on those.
And I know, Catherine, I mean, we'll get to the other question, but I know that kids are struggling with the Zoom learning as well, because not all the teachers are that effective on Zoom. And also many kids need that personal interaction. The attention span's not there to sit and listen to a teacher across a screen. I mean, I have severe ADD and I struggle paying attention to adults, so. But anyway, Arun, I believe we have another question. Yes, do you have your list with you, Arun?
Yeah, I'll go with this one. This one's from Vijay Lakshmi out of San Jose. She says, the coronavirus impacted jobs and some jobs may never come back. What's the reading on that? You know, in the industry, you know, what are businesses seeing? You know, a city perspective, what we're seeing is there is going to be a loss of jobs. It's unfortunate. And part of it's due to survival of the businesses. The other thing is it's about how do they keep the workers safe? You know, we had essential workers at the grocery stores. We had essential workers at farmers markets, at the hospitals. And even some of them are showing signs of fear because their confidence is not coming. So what are we seeing outside of that? Renu, maybe you can take a little first pass at that, and then we can punt over. Maybe Vikram can provide insight as well.
Yeah.
Vikram, you go first.
Okay. So based on the data and research that I've been doing and the numbers that are published, it's going to be about 35 to 40% of the restaurants will never come back again. That's actually a massive number. If you talk about just the city of San Francisco, which has about 80 to 90,000 restaurants, 30,000 of them will never come back again. That's actually a pretty staggering number. So I think, like, you know, there's going to be a lot of re-education and retraining that those folks will need to go through to find, like, you know, other jobs in other, like, you know, areas of life, because again, those jobs are not coming back, right? I think there's going to be also new opportunities that will arise out of this that people haven't thought about. For example, I think food delivery and such is going to become even more prominent, right? Ghost kitchens are going to become even more prominent. And I think for the restaurant industry itself, there's an opportunity to network with each other better and create opportunities amongst themselves. Because right now, each 7% of all of US restaurants are independent single location restaurants. So that means they are single location, they don't interact much with any other restaurants around them. So if there's an opportunity to create some sort of a network where you can actually employ more people or leverage the resources in a more meaningful way, I think that will create more opportunities for people as well.
I think one of the key points that Vikram brings up is how the restaurant industry is planning on changing. And Narinder, this goes right into your court. You talk about innovation and change, and now we have fixed assets, fixed footprints, and these landlords have an asset that they're going to potentially need to readjust their footprint and redo. Are you seeing any conversations of that nature starting to happen within the landlords, or new facilities that are coming forward getting redesigned before they even break ground? You're on mute. Narinder, please unmute yourself.
No matter, I practice all kind of commercial real estate, but I have a specialization in hospitality industry. Even I personally own a chain of hotels and a chain of restaurants too. Plus I sell all of them as well. So I'm seeing hotel industry is hardest hit, just like the travel agents industry. There's no airlines is going on, so nobody fly into the cities and where the hotels are by the airport in the city. So they are hardly hit. And again, they are very high, big ticket items. Like average good hotel is cost 10 to 20 million or more. And even there is some program available by SBA. They offered up to $2 million loans available, but once you apply, they offer 150,000 only. But they're running out of funds too. Everybody get $2 million, government cannot survive. Similarly, restaurants are smaller level, but again, the hardest hit accordingly. Just like Vikram said, a lot of restaurants are going to shut down. Even when we open it, it's going to run at 50% sitting capacity, and then occupancy will be further less than that.
Rishi, I know you wanted to, since we're talking about loans, you wanted to talk about briefly, if you could share something about the forbearance program that you'd like to talk about.
Yes, thank you. Absolutely. It's a very popular topic right now, especially as people are facing hardship out there. And, a lot of our economic stability and net worth is tied into our property. And of course, we don't want to lose our property. And right now, one of the good signs is that a lot of homeowners have a record amount of equity in their homes. So we're not going to be in the situation we were in 08, 09, 2010, where we had people who were underwater. So that's the good news. But with forbearance, there's a very good program that is going to be released on July 1st. You might want to note that down, and you can Google this for more information, or you can email me and I'll get that to you. But basically, homeowners can resume their monthly, the regular monthly payments and the amount of their missed payments towards the end of their loan term. So a couple months ago, it was said that you have to pay the full amount you missed. So if you missed 2 or 3 months of mortgage payments, you'd have to pay it all in once, like a balloon payment with potential penalties. Now, as of July 1st, there's a new program through Fannie Mae where they will allow you to pay back that loan at the end of your principal or at the end of your loan. So that'll make it a lot easier for people who need that 3, 6, 9, 12 months for cash flow if they can't make their mortgage payment without getting penalized or foreclosed on. So I think that's a very important update when it comes to the forbearance plan. And the forbearance plan really just means that you're going to defer that amount to a later period. This just allows you not to pay any penalties. You'll just pay that difference back at the tail end of your loan. The other thing I just wanted to say that, there's a lot of negative things happening, and we're working through it, and people have been resilient. But in the last week, we've had 4 or 5 really positive things happening in the real estate market that I just want to point out real quick. Number one, week over week, and this has happened for 3-4 consecutive weeks, that we've seen mortgage applications, especially from new first-time buyers, improve every single week. In fact, in California, mortgage applications have gone up, you know, almost 10% week over week. So home buyers are getting back out there. Number two, we're seeing a lot of fewer buyers backing out of contracts. When we first got in shelter in place and with all the anxiety and all the fear in the market, a lot of buyers and transactions were falling apart. Now that's not the case so much. Number three, our showing activity from buyers, and I think that's a lot to be attributed towards us being able to show owner-occupied properties, is getting back to pre-crisis levels. And remember, this entire environment was a health crisis first, which led to some of the financial crisis, unlike 08, where it was a financial crisis first. And then, of course, we're dealing with interest rates at record lows, which creates more affordability for a lot of people. And believe it or not, across the board, with our 300 plus agents and a pretty good, footprint in the Bay Area, we've seen multiple offers on most properties, which is a good sign. And in fact, one more stat I just want to share with you real quick. If you look at median sales price month over month, if I compare April 19 to April 20th, 1 year apart, in 5 different communities in our East Bay and pretty much Alameda, Contra Costa County, the 880 corridor where we live, Tri-City, had an 8% increase in price year over year, despite the shelter in place. Our West Contra Costa County and Central Costa County had a 8% increase in price. La Marinda area, when you go to Walnut Creek, Orinda, we had a 6% increase. The Tri-Valley market, where I know Arun, you live, we had a 2% increase. And
Thank you, Rishi.
16%.
This is great information. And, you know, I think what we're really finding out is there's a lot of change. And I wanted to just swing over and hop over to Dr. Parikh. You know, Doctor, this is Mental Health Awareness Month. And you've recently written a lot of articles and information of that nature about mental anxiety and how it's working out throughout the community. In addition, what we're also seeing is an increase from our police force on domestic violence. Is there anything that you can share from information that you may have regarding mental anxiety and maybe some tips that the community can really do, as they're not isolated and alone, and they really need to know options and choices, which maybe they never needed before? You're on mute. You need to unmute.
I think we need to, I'm not sure. Yeah.
Yeah, Arun, we have been seeing more patients seeking help for anxiety, stress, and physical manifestations of stress in form of insomnia. People are not sleeping for days and days, headaches, neck pain, back pain. Another symptom that's sometimes associated with anxiety that we've been hearing about from patients is what we have been playfully been calling is COVID brain. As a result of this chronic stress and anxiety, many people are experiencing difficulty with concentration, focusing, losing things, making simple mistakes, losing motivation, lacking productivity. You could be in front of a closet and not know why you're there. But I encountered that even otherwise. There's a lot of bad news out there. People are worried about their lives and their livelihood. Amygdala, part of our brain that detects threat and activates the fight or flight reaction, is on overdrive right now. And that's what I talk about in my articles, Arun, the science behind anxiety in face of threat and what we can do about it. And I won't go into details, but the few things that I talk about in my articles are, eating well. Food has a great impact on our mood. And in fact, that's the topic of my next article, food and mood. Keep moving. Exercise is medicine. Getting a good night's sleep. Limit or eliminate use of alcohol. And news circulating in the media can also put people in hypervigilant state. So be mindful of that. And even before forwarding or reposting a message, let it go through the double filter. Is it true? Is it necessary? Even if it's true, does the other person really need to know? So be mindful of that before forwarding news. Meditation, pranayama, or breathing exercises, affirmations. At our clinic, we have these virtual group classes that are also highly successful. Talk to your provider. You may even benefit from some cognitive behavioral therapy, or some patients may even need medications. Yes, you're right. This is a National Mental Health Awareness Month, and it's important to make mental health a priority, and not just during the month of May, but every day.
Thank you.
We have a few more minutes left before we wrap up. We actually have only 3 minutes, so I'd definitely like to have just very short closing statements. And I know I just said to Seba, we have to bring the show back. This 1 hour was not enough, for sure. So we'd like to hear from Ritu, of course, really quickly about the travel industry, something in closing for all our listeners to feel a little better about themselves. And then Yogi, make the city of Fremont feel a little better. So Ritu, over to you if you're there.
Yeah, all right. Yeah, I know we have a lot to talk and a lot of good, very valid questions and very valid topics. I'll be very quick about travel industry. We've been talking about, and we have been advising all our customers and in general to community to do think about taking travel insurance. And I think this pandemic has really, really taught us that what it can do for us. When we buy insurance for our homes, for our cars, then why not travel? And travel in today's time is a really big ticket item, especially when you're traveling abroad, overseas, or even taking a vacation. So I really want to step in here and then advocate once again, my friends, my community, do think about taking travel insurance next time when you buy. It does seem like an additional $1 on top of the travel funds that we are putting out, but it will definitely secure our travel investment, which is a really hard-earned money. And it's not a big ticket item. Buying just the insurance, it's just a few $100s over a couple thousands of travel investment. So I just want to say that in this session, I know other friends also have to chime in, that insurance is a great thing. Please do keep in mind whenever you are making any travel plans, just ask your travel provider to add on the insurance. It will go a long way.
Thank you. And Yogi, message to the city of Fremont. All the residents are panicking.
Time is brief. In the interest of time, I'll just leave with one message. Let's all be strong. Let's all be in solidarity. This is not about one group versus another. We have seen vulnerabilities in our fixtures in our community. Let's solve this together. Times are tough. Let's be respectful of the ill, the elderly, and the unemployed. Cities want to help. Cities are doing the best that they can. I think good times will come. Let's just be patient.
Thank you. Arun, quick closing statement before I wrap up.
Well, I just, to Yogi's point, I know at the city level and at the county level, we're all trying to work in this together. We're getting briefed regularly, and we're trying to share information, making sure that we can communicate all the opportunities that people need to thrive. Once they have the solutions or know where they can go, that's one level of dropping anxiety. And I think it's really key. Communicate, reach out, and share with people your caring, your willingness, and your love. Stay strong.
Thank you so much. Thank you, Arun. Thank you, Catherine, Narinder, Dr. Parekh, Rishi, Ritu, Vikram, and Yogi. Thank you. And of course, Radio Zindagi, thank you so much. And basically, my thoughts in closing would be, I hope this virus has awakened the humanity within each and one of us. If you watch some of my YouTube stories for kids, I think adults should watch it. I talk about what we have destroyed in this world. And even animals and even the tiniest little insect is more human and more compassionate to the rest of them around them than us humans. So let's awaken the little humanity within us, compassion, and as Yogi said, help one another. And most importantly, please support your local businesses. I don't want to see any business shut down. Let's support them, do whatever you can, and stop living in fear. I think you have more chance of being knocked off by a drunk driver on the road than you would coronavirus. So thank you again. Thank you, Ira, and good afternoon to everybody.